Dr. Sadhvi is a double certified gynecologist. She specializes in both traditional and integrative medicine. She's got a private practice here in the city, and she's passionate about empowering women to take care of their own health. So you operate also under Tara MD, correct? So anyway, come on up. We're going to do black and white.
All right.
Teams. Exactly. It's color wars. Okay, so these two dynamic monk filmmakers. I mean, I never thought I'd find myself saying that. I actually texted my sister this morning and I said, I think the monks are asleep and the cameraman's on the sofa. She's like, this isn't like a normal thing that happens to people. Anyway, so these dynamic monk filmmakers have come from Texas. Thank you very much, and they have earned international acclaim. Their work blends spirituality while advocating for social justice. They both strive to inspire audiences to take meaningful action and reflect on deeper meanings of life, all while remaining true to their vows of nonviolence and compassion to alleviate suffering. Their newest projects, they've done 2 documentaries prior to this, is called Balance, which is a 4-part docuseries to raise awareness about perimenopause and menopause. Come on up, ladies. We are definitely going to be talking about menopause, and there's many of you that when they were responding to this invite, they're like, I need this so badly. So anyway, please find the time please find a spot for me. But I first need to ask you, because the whole idea of being a monk or anybody that has committed themselves so intensely and with such conviction, I've got questions about it. So, very briefly, how did you become a monk? Like, how did it?
I don't know if briefly is possible.
I know. Just 5 words or less. No.
Calling, right? So, well, for me, I experienced a lot of pain in my life. I served in the military. I was deployed to the Iraq War, and I saw a lot of violence, and I experienced that. But before then, I was already on my own spiritual journey, beginning with self-love. And so from that, I knew that I wanted to do more with my life. I wanted to serve others and also grow spiritually. So I decided to become a monk, and I've been a monk for 16 years now.
And you you came to the ashram?
Yes. So we have a spiritual retreat in Texas, and what brought me there
what's the name of it? And it's right outside of Dallas.
Yes. So we are about 45 minutes outside of Dallas. The name is Siddhali Spiritual Retreat. And I went there for the first time in 2011, just as a guest, just as a retreater. And what brought me there was, I was 29 years old, and for me, it was asking the question, like, what is my purpose in this life? Like, why am I here? What's the purpose of existence? Like, I felt like there had to be something better, greater for me, and just for me to do as well. And so coming to the retreat and meeting my 2 teachers, Sadhvi, Shree, and Acharya Shree, it changed everything for me. The direction of like where I was heading, it was a wake-up call, it was purpose, it was everything. I began to practice nonviolence, which is the main principle that we follow as Jain monks. So.
And speaking about nonviolence, you ended up meeting and obviously really just connecting in such a deep way. You had decided, how did you come up with the idea to do a documentary on human trafficking?
So
because because this is how I envision it, and I'm being honest. I envision that you wake up at 4:00 in the morning, that you are praying most of the day, or just very much kind of in the spiritual realm. And I wouldn't think of someone that is living in an ashram of doing a documentary on human trafficking. And I just think that makes sense to me now that you're saying it, because the commitment to doing good in the world and making a difference. And I asked her, why did you end up in Texas, like an ashram in Texas? And he said, but
which part would you
go to the place that needs the most change.
Anyway, sorry.
So I'm proud to have moved from LA to Texas. It's a beautiful place. It's a beautiful ashram. Would love to see you all there.
I know, it'd be so cool. We should all go.
Retreat.
That's where the next retreat is.
Exactly. But it really began with our promise. We made a vow to each other that because we experienced violence in our childhood, that we wanted to prevent child sexual abuse. And so we made this promise. We didn't know how it would happen, but it was something that we'll figure it out one day. And so we had learned about human trafficking, and then, I don't know, it was just this idea that came, like, instead of writing a book, why not make a film? And so from there it became movies create movements. And so raising awareness about human trafficking, sexual abuse, other causes that we care about. So we found this medium that is changing and helping lives. And for us,
what are the two names of those?
So the first documentary is Stopping Traffic, and then Surviving Sex Trafficking, and then we have another documentary that raises awareness about the stray animal crisis of Houston called For the Animals. And so Balance is our fourth project.
Wow, that's amazing. That's amazing. So how did you then come up with this topic? I mean, because you're in your early years.
Yes.
It actually started 30 at 35, believe it or not. But truly what moved us was at 38, Sadhvi, Siddhali, and Shree started to go through changes, unexpected emotions.
Rage.
And she
I want to
really,
kill you, but I can't. I'm a monk.
Non-violence.
Exactly.
and it was like not her normal self. And so there was some friction, there was, those emotions. And finally, one day I came across a video from Dr. Amen on social media. And he said, before 10 years before menopause, you might begin to feel or experience a list of symptoms. And it was like, check, 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 check. And I'm like, hey, more respectfully, and I said, maybe this is you. This is, what you're going through. And so we looked into it, and yes, it was for the first time we heard the word perimenopause. And she was 38, I was 39, or maybe 40. And for us, it was like, we couldn't believe that at 40 years old, we had never heard the word perimenopause. And of course, finding out more about it and all the disparities and like all the other things, we were like, how come nobody has ever told us about this? How come nobody has ever prepared us for the changes that we're about to go through? And so I think that's what sparked the idea that, okay, we need to raise awareness about now perimenopause. And we thought, let's educate women. And then the more we found out about it, the more we realized, like, okay, we're gonna educate not only women, but all the medical professionals, because we're gonna get more into the conversation, but that is one of the main problems here, is that the medical community is not educated and trained enough about menopause.
Okay, but not Dr. Fetsky. Okay, and this is where she steps in. So from a medical point of view, what's happening to our bodies 10 years before, and then the hormones just fall out of our body. With everything else, they're just falling out. But tell us what's happening.
So I mean, menopause first off is a clinical diagnosis. It just means 1 year, no period, and that's it. There's somebody arbitrarily made out the time period of how long it would be. The 2 to 10 years ahead of menopause is perimenopause. So this can start in your mid-30s, depending on when your trajectory is, or it can start later. It can start in your mid-40s, depending, right? Because normal menopause is anywhere between 40 and 60, right? So most women's going to be about 45 to 55, but 40 to 60 is within the normal. And there's even not just perimenopause, right? There's early, there's mid, there's late, and lots of fun things happen with each of those stages. So in early perimenopause, you can have, regular menstrual cycles, still not really even be on your forefront of your mind, but perhaps, worsening PMS symptoms, maybe a little bit more rage during right before your period, maybe some weight gain, maybe your menstrual cycle's changed, maybe it's a lot heavier than it used to be, maybe the cycle length's been different. And that's even the first cardinal signs of perimenopause, which most of us ignore. We're all busy, we don't think much about it, we're working at the same time, we have kids maybe, or just busy lives, and you're assuming that, I'm a little bit more ragey before my period right now, because life's a little bit more rough. And then I call the mid-chaos stage, which is my favorite word to use for it. And mid-chaos is that stage where You may have a few months of a regular menstrual cycle, you may skip, you may get 2 periods in a month or multiple months of 2 periods in a month. So your hormones are just rapidly fluctuating all over the place at that stage. Later perimenopause is more kind of that traditional thing that most of us think about, where you're skipping periods more regularly and having more of those estrogen deficiency symptoms. Because actually in earlier perimenopause, it's not estrogen that's causing the symptoms. It's actually declining levels of progesterone that are causing those symptoms. And then mid-stage is just pure chaos. So.
And so with the hormones, with the hormones kind of going down, we talked about this and kind of skipping ahead a bit, because obviously this is a very big topic and we'll certainly be covering it again. But in terms of, kind of, we talked about, like, I have high cholesterol. And I felt like I could handle it with diet and exercise. And the idea that I would have to take medication, I felt like a failure. Like, truly, I was like, I can't do this on my own.
I love that you said that.
So I felt terrible. I still kind of do. Like, I should be able to figure this out. The same thing, I think, goes along with menopause, where, you were saying, like, there's a kind of maybe a prejudice about taking medication, doing some intervention. But for many other things, you were mentioning about, your eyesight's going bad, you wear glasses. Like, what is the problem with kind of having some relief, feeling better, if it has to do in the form of medication or hormones? So the interesting part of episode 1 was that they were talking about the series of the studies that were done about hormone replacement. So can you touch on that? Because that's super important. I know all of us need to kind of not understand it because it's not so clear, but
I think it's very important for all women to know about this study that was conducted by the is it NHI or WHI? The WHI, which caused a lot of problems.
This was when? How long ago?
You can get into the details, but this happened back in 2002. And so the results of the tests were misrepresentations, you can say. It scared not only the US, but the entire world about it.
It was addressing hormone replacement.
It was addressing hormone therapy, right? And it turned out that they said that it was increasing the risk of breast cancer. So that's why when you hear today about hormone therapy, a lot of women are very afraid to go into that, because you have heard always that it causes breast cancer, right? So they thought that there was an increase in heart disease and a few other things. So it turns out that it was the wrong group of women that were studied under that study. The wrong group of women, the wrong type of HRT, and given at the wrong time. So basically the women it was already basically past the menopause time. The majority of them had already been like without hormones, like naturally for a decade or so. And so the results were not accurate. But because of the media took all the bad things from it. And from one day to the next, basically all the doctors dropped prescribing HRT, and the women taking HRT stopped taking it. And so we went from like 40% of women taking HRT to basically 0%. Almost.
And is that, just in terms of, so is that something that, in terms of, you've obviously not been a doctor all that long because you're so young, but no.
Mid-40s.
No, but when you were in medical school, what were you being, or were you even being taught about hormone replacement or menopause?
When I was in medical school was actually when the WHI study came out.
Right.
So no, and then more important was actually when I was in my OBGYN residency. I had actually one fantastic mentor who was a Spitfire, and she was much older, and REI actually, back when REIs actually did menopausal management.
Okay, sorry, REI.
Reproductive endocrinology, but she actually did menopause.
Okay, so that is a doctor that just specializes on kind of hormones.
Well, yes, but now a lot of REIs focus more on the infertility aspect.
Okay.
But
Can you hear in the back? Because if you can't,
no.
okay, you know,
I'll
just
speak up.
turn towards that. Turn towards that.
So the at that time, even if you were going to give hormones, the phrase that we were always told is, try to avoid it, try to avoid it. If you're going to give it, the smallest dosage for the shortest amount of period of time. And then we were even told that the cap was 5 years. You had 5 years to be on hormone replacement therapy.
And so would you, like how much time as a doctor being trained, how much time did you spend learning? I mean, you've done this now after the fact,
Right.
but when you were in medical school, how much time was spent learning about this? Like 50% of our life, half of our lives are going to be spent, not half of our lives, but a third of our lives are going to be spent in menopause. How much time?
In medical school?
Yeah, in medical school.
I can't even remember learning about, I didn't even know there was a term perimenopause in medical school. I think we touched on menopause in
And you
medical
didn't go to school in the 1800s.
No.
You know what I'm saying? I mean, like,
Yeah,
this is insanity.
No, absolutely. Yeah.
So what have you found in your practice? Why have you, because, well, first of all, let me just tell you, I was looking for a new gynecologist, and I walked into your office, and I had been referred to you. And first of all, the office was great, and it was beautiful. And then I saw, like, there was lubricant, and then there's vibrators, and I was like, I love this woman. This isn't the waiting room. You didn't keep me waiting. Had you kept me waiting, maybe we would have opened them up. But anyway.
Why is she going to use the bathroom? We could test her.
Exactly. But anyway, I love that that's out there because it opens up the conversation. Like, I went to a gynecologist before. She didn't have me on any progesterone suppositories at all. So can you just say, because I assume that everybody here knows that they probably should be, and I don't want to say must because I'm not a doctor, should be having some basic hormone replacement, even in the form of suppositories. Is that correct?
So estrogen suppositories.
Yes, exactly.
So
just explain
right,
that.
yes.
Because
So it's very, very different understanding systemic hormone replacement therapy versus localized hormone replacement therapy, which is not, it's estrogen. So systemic hormone replacement therapy is what we talk about mostly when we're talking about hormone replacement therapy. But even if that's not,
which would mean a patch, would that be a pill?
Well,
or
there's
would
so
that-
many options.
Okay.
Yeah, patches, pills, gels, sprays. I mean, there's so many different options, creams. But even if that's not what you choose for yourself in regards to being on systemic hormone replacement therapy, there are a whole complex of symptoms that happen that you may even be noticing, right? You may be getting up in the middle of the night to urinate. You may be urinating more frequently, vaginal dryness, pain with intercourse, just dryness and discomfort in general. And even if you don't choose to do systemic hormone replacement therapy, this shouldn't preclude the option of being on vaginal hormones. And the main hormone is estrogen, right? That's usually used and readily available and covered by insurance. There is also other options that's kind of vaginal DHEA, which is nuanced in itself and more difficult to get insurance coverage. But the benefit of that, at least, you could still be on that. It's locally acting. It does not elevate the blood levels of your hormones. It's not the same thing as talking about systemic hormone replacement therapy. And I think that a lot of women are like, I definitely am still scared or fearful to be on a hormone replacement therapy. But you should understand that there's none of those risks we talk about, or even the studies we talk about, relate to vaginal hormones.
And the vaginal hormones, the lining of your vagina thins out.
Yeah.
Period. Nothing you can do about it. It's thinning out. So it also opens you up a little bit more to UTIs potentially as well, right?
Yeah.
Because you don't have the protection there. So it's imperative that you do that. I mean, you really, and I mean, whose gynecologist has talked to them about that? I mean, that's sad. That's insanity, okay? So that's the first thing you need to do. And yes, okay, sorry, let's go back. So,
I'll actually attest.
Sorry,
I'll confirm this. I actually had my very first UTI a couple of months ago, and I got the cream because I heard about it through making the series. And instead of doing the antibiotics, I did the cream for about 2 weeks, and the urgency and all of that disappeared. And I'm like, oh, it really works. So we don't think about it. And you have to ask your gynecologist. They may not even know why they're giving it to you, but you can advocate. You can advocate for yourself, and that's the importance. What we're aiming for with the series. It's like not only the education. Here's the information. You make your own choices for yourself, but now you can advocate confidently to the medical providers. There's amazing doctors out there who are very well trained, and they invested in their own education to learn more. But most of the doctors that you well know are not familiar.
So what surprised you the most? A couple of things. Probably there's been a lot along the way. But in terms of starting this journey, you're going through this and saying, listen, these are the things that I'm learning. Two things. One is, did you both kind of take a more I'm going to go the natural route, I'm going to take some supplements or I'm going to do some hormones? Did you, the two of you, because I haven't watched more of the series, did the two of you take two different paths, or are you kind of exploring along the way?
So I'll briefly say mine. So when I found out I got low progesterone, I took a hormone test because I wanted to see if I was in perimenopause, and I took a saliva test and it showed that I had low progesterone. So
wait, hold on one second. I just want to talk about testing with the hormones, because the hormones are done very differently. Mm-hmm. I just got a hormone test that I have next to my bed that I have to take. It's like a whole day thing. No, it's a very intense, like a 5-time urination on a, what's it called?
That's a Dutch test.
A Dutch test. Okay. So, So, what kind of tests should we be getting?
So, I do the Dutch test, right? I actually come integrative, do a little bit differently. I will say that you don't need any testing, okay? If you're having your symptoms, you're having your symptoms. You don't need to have any testing. If you're in perimenopause and you do sort of blood testing and have your insurance cover the blood testing, it's going to be a random marker. There are certain hormones
depending on the
where
time
you are in your cycle, or where you are in the month, or what month that is. Like I said, you can have the chaos stage. So 1 month can appear one way, 1 month can appear a different way. So you go based on your symptoms first and foremost.
And the strange thing is, for the Dutch test, I can't have bananas or avocados for 2 days
and
before.
fava beans.
So that's what I'm saying. Like, I didn't know about fava beans. So also, it's like
Here's
I eat
why.
a lot of avocados, so that's going to screw things up. Anyway,
It's
sorry.
just it's a different test. It looks at organic acid components of things, so it affects the organic acid component of the test. Yeah.
So you don't. So you would say you don't have to have it.
You don't have to.
No, why would you say you don't have to? Because you found out that you were low progesterone. So how would she know that she has low progesterone?
Symptoms. I will say.
Okay,
again,
so what are the symptoms of low progesterone? What are the symptoms of low estrogen?
So again, that goes back to the early perimenopause. So if you're having regular menstrual cycles, but perhaps your period's gotten heavier than it used to be, and you've had the ultrasound and they haven't seen polyps or fibroids or anything that can explain it otherwise, the heavier periods is a sign of progesterone deficiency. I think it's important, if I have a moment, to understand what progesterone is, because I forget people don't even understand. We think estrogen. So progesterone actually is created by the corpus luteal cyst. So when we ovulate every month, we create this cyst that produces progesterone. That's supposed to help prepare the lining of the uterus for pregnancy and support the pregnancy. And then if you have a pregnancy, it's not until 12 weeks that the placenta actually takes over and produces progesterone. So what progesterone does is it's the great balancer. It balances out estrogen. Signs are that if you're not producing enough progesterone because you're in the earlier stage of perimenopause and you're not ovulating every single month, or the quality is not as good, is that heavy periods, worsening PMS symptoms, or that kind of drastic decline or not enough of the progesterone. If the menstrual cycle is shorter, if you used to be 28 days by the book and all of a sudden now you're 23 days or 24 days, that's going to be a sign too. And I will say that, it's not because I do the Dutch test. I think it's a great additional test to do, but it can be cost prohibitive for some people. So I think it's important first to focus on your symptoms and what's going on with your body. And then if you want sort of that additional testing, like that Dutch testing, you need a certain provider, because not your traditional gynecologist is not going to do it. It's going to be a functional or integrative doctor who does that.
And how much is it? I have it. I'm doing it anyway because it's next to my bed. But about how much is it?
So it's if you go directly through the company, it's a $400 test.
Got it. And so what would these tests show? So you started on progesterone.
I did. So I turned to progesterone, and when I decided for a test, I went to Dr. Google. I want to figure out my progesterone levels. So I took a test. I had no idea. And then eventually I actually shared with Heather, who's our EP on our project, and she
Executive producer.
Yes, and
Heather,
happens
raise your hand. There
to,
you go.
and she happens to have a med spa in New Mexico, and I shared with her what I was going through. She's like, I'm actually just bringing, hormones in. Is that something you want to explore? And I'm like, I'm so desperate. I haven't been sleeping. I haven't been.
How are you having hormones in med spa? Like how are they?
I have no idea. I just told her. And so there's, you have different doctors that, they have the concierge services. You have your community, centers, like med spas offer hormone treatment. So obviously they do.
A lot of them do.
Really? So you're going to, gotcha, okay.
So she had a nurse practitioner who is a hormone specialist, and so I turned to them and got my first, progesterone, and that helped me sleep. And so I was like, I started to feel like myself. And so again, I didn't even know much about perimenopause. I just knew I wasn't feeling like myself, and something needed to change, or something was going wrong with my monk life, and I know that wasn't the truth. So I was grateful to get help and feel like myself, but I was still unsettled because I didn't even know what's going on in my body. And then I think through my journey, and then her starting to go through her symptoms, so I opted for the hormone therapy path, and she decided to take.
Well, for that, I was like, well, I don't have any of her symptoms, but Heather suggested maybe I should also take a test. And I was like, yeah, sure, I'll take it. I'm gonna pass it. Because I feel fine, right? And then I go and I get tested. So we do a saliva test, and it's very specific. You have to do it between day 19 and day 21 of your cycle to be more accurate. And
depending on how long your menstrual cycle is.
Right, depending on how long it is. So me having a regular cycle.
A 28-day. Okay, so based on a 28-day, it would be 18 and 20.
Yeah,
Got
so me having a regular
cycle. Hold on 1
cycle.
second. One other thing that's on your table, there's pads there with pens. You can take them home with you, but write down whatever write it down, because if you're putting it on your phone, then we think we're boring you and you're texting your friends and saying, get me out of here. So anyway, but you use those because a lot of the stuff I won't remember to send to you. Sorry, go ahead.
And so, I'm walking in there very confident, like I'm gonna be fine. And it turned out that I was like super low with estrogen and progesterone. But I didn't have any of her symptoms. Like I sleep like a baby, I was fine. But I did notice that I was extremely tired around that time, like no energy, I couldn't focus, just like that. It wasn't like fully brain fog, but just not the ability to focus and function the way I was functioning before. So those were my two main symptoms. And so I thought, maybe it is the lack of hormones, or maybe something else. And so that opened up an entire thing where I was like, okay, I'm determined, like I need to figure out what's happening to my body. Turns out I was fully anemic. I was in the pre-diabetic category. I had high cholesterol. And it's like, wait a minute. The monk that teaches yoga, that meditates every day, that lives in this beautiful, peaceful place, that eats a vegetarian diet, And so I started to feel like, I failed. I failed at everything. Maybe I should have done more yoga. Maybe I should have meditated more. Maybe I should have done more breathing techniques. Maybe, and it was this feeling like, what did I do to myself? I started to blame myself.
We beat ourselves
right?
up.
Yes. And so it was very eye-opening, and it was like, okay, I need to figure this out. I need to fix my body right now.
So you started on?
So I started to fix my deficiencies. Like my process, it's like, let me bring back my level of iron, ferritin.
But who were you doing this with? Because you can't do this on your own.
Right.
So were you working with a functional medicine person?
So I chose a naturopathic doctor just because for me being a monk, we've dedicated so many years to purification of our body, purification of our mind, that I was just so afraid and worried about like HRT and what did that look like and what would that do to my body.
Meanwhile, she's here.
She's
just
doing
like she's putting the patch on. She's
yes.
and you're like,
we're two different souls.
You're like, You go knock yourself out with the kale. I'm slapping it.
And I don't blame anybody for starting with HRT, because if you're not sleeping, if you're full of anxiety, you do what you have to do.
So what ended up happening in your journey in terms of?
So I'm not gonna reveal it because you have to watch the
That's
series.
right.
But I will say that it is a journey, and I don't oppose hormone therapy at all. We all have to respect each other's path and how we, go into whatever path we choose to go into. But yeah, it's going to be part of the story.
And that is the great thing about your practice, because
bring them all together.
Because you bring it all together. So tell me how you do that. So let's take me. So I don't have, well, there's a slight history of colon cancer, which can tie in with breast and in my family, but I've got Alzheimer's in my family, and I also have high cholesterol. Mm-hmm. So those would be the reasons why I would want to, I think, look at my hormones and get them back up, because it does, in theory, help with heart health, right? Lowering your cholesterol potentially, and also with brain, because I have brain fog sometimes. I feel like I hit a wall with my brain. But I also have a potential clotting issue. Mm-hmm. So that would make me concerned. So tell me kind of how do you navigate that? I mean, do you start on a small amount? Do you
Yeah. So first off, the hormone replacement therapy does, as estrogen levels decline, your LDL and your cholesterol goes up.
Okay, LDL. Remember, LDL needs to be low. HDL needs to be high.
Right.
Okay, that's how you remember. That's part of your cholesterol.
As estrogen declines, LDL goes up, insulin resistance goes up, prediabetes.
Yep.
Starts popping up. So you're saying, I haven't changed my diet, I haven't done anything differently. Why are these things changing? And that's the answer behind it. Family history of colon. Well, first off, hormone replacement therapy is still kind of a little bit behind the game. In the national organization still will not recommend that you be on hormone replacement therapy.
This is my heart medication I have to take. Hold on 1 second. There you go. Sorry,
the national organizations don't recommend being on hormone replacement therapy for, those reasons. Right, they still don't get behind saying that prevention of heart disease or prevention of colon cancer is an indication for being on hormone replacement therapy. But it's true that we have studies that show that hormone replacement therapy decreases the risk of colon cancer. Depending on when you do hormone replacement therapy, it can decrease the risk of dementia. There's some conflicting data on the studies that we have. That's why there's kind of that window that everyone talks about also in regards to when you want to initiate hormone replacement therapy.
And so when would that be?
So ideally within 10 years of menopause or by the age of 60. Now that being said, you're going to look at the whole person, right? For some women, they go through menopause, like I said, 58 years old. So 3 years later, say you get to 61, are you going to say that woman should not be on hormone replacement therapy? You want to be aware that there's an increased risk or a slight increased risk of certain things like dementia, stroke, blood clots, so on, if you initiate hormone replacement therapy. But there's a workup that you can kind of do.
Have there been studies that say it helps with dementia and it doesn't help and it hurts? Mm-hmm. Helps and it hurts. Mm-hmm. Right. Yeah. And it gives you cancer and it doesn't give you cancer. So, I mean, because there doesn't seem like there's been a definitive. Nothing's definitive in medical, right?
Right. I mean, the largest scale randomized control trial that we have is the Women's Health Initiative trial.
Which went south.
I'm sorry.
Yeah.
I'm not following what you're saying.
In regards to which part?
Well, I can't hear.
I'm sorry, what?
You're saying when you're 61, you can't do anything anymore?
So I'm saying that the guidelines are saying that there's an ideal window within 10 years of menopause or by the age of 60, right? So that's what the generalized recommendations are.
You should start it then.
Start prior, yes.
Start prior, that's the end of the window.
Right, yes, that's the end of the window.
Okay.
That being said, each person's individualized. So I gave the example, for example, if you went through menopause when you were 58 years old, right, which was 3 years prior, then it's a little bit of a different story versus you went through menopause at the age of 41 years old and you now at 61 want to be on hormone replacement therapy. So it can be individualized. If you are working with somebody who is a good menopause provider, there are certain things you can kind of look at and really assess as for you what your ideal window is.
What's the question? What I don't understand the difference between hormone replacement and bioidentical. Like, or is that the same? Like,
It is
that the same?
Yeah.
Okay,
so
so you're
hormone
just saying.
replacement just talks about all the different types, right? So initially, what was used was Premarin, right, which is actually conjugated equine estrogen collected from pregnant horse urine. The bioidentical term that came out is kind of a little bit of a catchy term. And the difference between synthetic and bioidentical just means that bioidentical mirrors the same chemical structure as what your hormones are, and synthetic has a different chemical structure. We still use some providers still use some synthetic hormones. Premarin is still used, right? But most people favor now using estradiol, which is we make 3 estrogens in our life: estriol, estradiol, and estrone. We actually make a 4th estrogen in the fetal period of life. But estradiol is our dominant hormone during our reproductive years. So now it's come into favor more so using estradiol and giving estradiol back.
And that is a synthetic? It is not.
That's a bioidentical.
Okay.
So bio or body identical just means the same chemical structure as what your hormones are.
Got it. And what do you, in terms of supplements that you have found that have been helpful, same thing with you, when do you have people that come and just say, listen, I do not want to go ahead? Okay.
Yeah,
So then what have you found that really helps? That's kind of an across the board. Obviously everybody's different, but are there certain things that really have given,
So it depends on what the symptoms are, right? So with supplements in general, you're going to be kind of more targeting the individual symptoms that are more problematic.
sleep? Who's having
Right,
problems with
right.
sleep? All of us. Right. Okay, so sleep, using magnesium, is that?
Okay, so for sleep in general, yes, magnesium is a great supplement. You want to choose your magnesium based on what your other kind of symptom profile is, right? So if you have constipation, then maybe you want to use magnesium citrate as the magnesium that you're using. If you don't have any of those symptoms and you want just the most bioavailable or body available magnesium, the magnesium glycinate is the most body available magnesium. For magnesium, in general, you want between 300 and 600 milligrams actually. So when you look at them, most of them, So when you look at them and you're supplementing, actually, most of them are smaller dosages. Most of them are like 110 or 120 per capsule. So you have to look at the bottle and look at what it is. But magnesium can be very helpful to help it activates, more of that parasympathetic nervous system, more of that rest, calm, digest nervous system.
Taking it before you go to sleep. There's a supplement called Calm. I don't know. I mean, I'm sure you've heard of it.
Yeah.
I think some of it has melatonin in it too. That has helped me. You just have to not take too much of it because you can feel tired from it. But
Right.
but anyway, so yeah. So obviously, coming to wonderful people that are very that are going to take what your symptoms are and make sure that you're coming up with a plan to help that individual person. Not making any sense. Sorry, I'm having brain fog. No, yeah, I need my supplements. Where are you at the moment in terms of the documentary? Have you? I know that you haven't finished because you were in my living room interviewing somebody's husband, and Heather's husband actually. And I was there. I said, "Well, is he a doctor?" And he said he was a husband, and talking about the relationship and about how that affects things. And so, I mean, that was an interesting part of it. If you want to just, because I know you just interviewed him, what did you learn from that?
Please tell me.
Heather, can you step out?
Heather was not there. Heather was not there.
He's a great husband.
We just wanted to hear the male perspective. How does it affect them as males, as husbands, as they see their wives going through such a difficult time? We are hearing about from all the women, how it's affecting us, but do we ever hear from the men and their perspective? And also we wanted to know, do you all talk about these things with the men? Does anybody prep you for what you're going to go through as, with your wife? And it's shocking. It's no, they don't talk about any of this. And so just like women are fully just kind of blind from this and not fully educated or aware, I mean, of course, men are much worse, right? They have no knowledge, no preparation, no education, no understanding of anything. And that's why we see a lot of divorce happening in the 40s and 50s, right?
None of anything.
Yeah.
And so, yeah, so we just wanted to hear the male perspective and how it impacts them and their relationship, you know, and it's not just the relationship itself, it's like, it's other things, other aspects that they get affected by this. So.
There was one word that he stated in the interview, and it was really touching. He said, "I felt helpless." And you can feel like the empathy, like he couldn't save her from what she's going through. He couldn't understand. She didn't understand. She didn't know about, you know, this is that phase and it lasts this long and it can affect your mental health, emotional health, physical health, all of that. So he felt helpless as she's just you could say trying to survive and just trying to make sense of the world, and while not feeling yourself and feeling crazy. So as a husband, he was just like, I felt helpless. And I thought that was so honest of him to reveal that.
Right.
That he had no control, he couldn't fix the situation.
Right.
As a male, he wanted to fix things, but he couldn't.
Right. I want to just talk about one more thing, and then I'm going to open this up to questions, because I know that everybody's got busy lives, and I so appreciate you all taking the time to be here. So in terms of mental health, a friend of mine is just really, she said, I'm having invasive thoughts. Like she said, I think, you know, she stopped taking an antidepressant and a pain medication, and is in perimenopause, clearly from her symptoms, and she's just like really having a tough time. So in terms of hormone replacement, I mean, do you see a big change in that? Do you do that with obviously changes in, listen, I think diet, and I hate to say it because I don't want to be that person, but I got to tell you something. After I had a heart attack this summer, and I've had to change. I'm not a poster child for a heart attack, right? But I really have found that sugar and alcohol, which is sugar and alcohol, it's a big deal, and they're starting to write about it to try to cut that out. But do you, besides exercise, besides diet, because that is so important, I don't want to say besides, are you, when you have someone that's really having really serious kind of emotional issues, are you working with the hormone replacement but then also antidepressants, or do you find that a lot of the time the hormones will help, or what do you see from a medical point of view? And obviously you're not a therapist, but
the mood changes with perimenopause are significant. I mean, for me, that was what drove me to really take care of myself when the mood stuff really kicked in. But you know, I think that we all have to realize too that it's not an either or, right? You know, you keep hearing sort of with perimenopause and menopause, people being like, oh, you know, these doctors, they're not giving the hormones, they're giving the SSRIs or the antidepressants or the anti-anxieties. And that's not necessarily wrong. It shouldn't be an either or, but you may need to be on those medications as a bridge therapy until everything gets controlled with your hormones and everything. And there's nothing wrong with that. It doesn't mean that it's for life. It means that it's to get you through a certain period of time. Hormones take a while to kick in, right? Progesterone, you feel a little bit more immediately. Like that first time you take it, you go to sleep and you feel, oh, well, it's fantastic, it's much better. But hormones in general take a little bit of time to get situated. Definitely hormones do improve all the mood, depression, anxiety, the anhedonia, just feeling like you're not wanting to do anything that you used to want to get out there and do. And you know, there's also, whenever you're approaching it, right? For me, the way that I practice medicine is that you focus on the whole thing. Do you have the stress management skills in place? Yes, move your body. What are you putting in your body? Because there's things you'll realize, even with anxiety, when you have, you know, when your sugar, for example, right, is not controlled and you have a high sugar meal at bedtime and then you go to sleep and you get hypoglycemic or it drops down, that's going to bring on anxiety. That's going to worsen your night sweats. So it's everything together is really, really important. Definitely hormones can work, and definitely if you're that person who does need that antidepressant medication or the anti-anxiety medication right now to get through, you should do it. And there's nothing wrong with that. There's not a failure with that. And no matter what social media tells you, that's what you need to do to keep yourself healthy to get through right then.
We were talking about, you know, we're talking, you were saying I just felt like such a failure. I was saying I felt like such a failure. Then we were talking today and you were saying, you know, I just felt like I had to see a therapist. And it's like, that's such a strange thing because you are supposed to be these spiritual beings. Like a therapist shouldn't have to see a therapist. A monk should be so evolved that you wouldn't have to see a therapist. And I loved that you said, I need to see a therapist. Because we all need to just give ourselves a break and cut ourselves some slack and stop beating ourselves up. We're not failures, we're human beings. And, reaching out and getting help, there's nothing wrong with it from a medical point of view, from an emotional point of view, from a community point of view. That's just so important. Where are you in terms of your kind of pitching the?
That's a good intro for where we're about to.
That was all planned. That was planned for
So you have obviously worked with documentaries before, so you know what the drill is. So you are.
So right now we're pitching the series. We're hoping to land a major streamer. Ideally, we land on Netflix. This way it can be seen around the world. We also have a plan B in any case it doesn't land on a streamer. No matter what, our series will be finished and it will be out in 2025. That is our
I'm going to end with one thing, and then I'm going to open it up to some questions, for just a few questions. But Stephanie Collins, is that Stephanie? Just raise your hand. So we were sitting there talking in my apartment before we came down here, and she works for a very cool company, which we're not going to go into. But one statistic, just one tiny statistic, there are 15 patches for testosterone for men. How many are there for women?
Zero.
And the protocol in some cases is to basically take you can only take 10% of this, so take a tenth, cut the pill in tenths or something. It's insanity. So we have to, as women, push to be the studies done on women. We have to push to be taken seriously. We're not just emotional. We're not just an emotional wreck, and this is just all in our heads. But we've got to push for that, and you've got to advocate for yourself, and you have to find great information. I love that you're doing this. This is so wonderful. It's a gift to everybody. You've got to find wonderful doctors that will hear you, that will listen to you and take what you're going through very seriously, because you deserve it. Any questions?
Before we open up,
Sorry.
Thank a few people. So I'd like to thank Dr. Fensky. When I met her a couple months ago, I had a question because I was like, well, I'm on estrogen, I'm on progesterone. Why am I feeling like I have so much brain fog going? And so it turns out I was advocating for myself a little too much, because I'm like, the brain fog's getting worse. Give me a higher dose. And it's like, this patch. And then I was like, but it's getting worse. I felt like I was walking underwater. And she would say, you look like a lost person, right? And I didn't understand that. And so I was so grateful to meet Dr. Fensky, because she said, well, are you cycling? I was like, yes. Is everything normal? Yes. She's like, you actually don't need that high of a dose. And I went to the lowest dose. I was on a 0.5 at the time, I think, and I cut it in half. Everything changed. And so that's the importance of having doctors in your life that get this whole thing. So thank you, Dr. Fensky. I also want to thank Dr. Dina Peralta. She's also a New York-based menopause specialist, and we spent so much time with her. She focuses on perimenopause, menopause, weight gain, but she's working with me to help me reduce my inflammation and improve my health. So I'm so grateful to you. And then I also want to thank Dr. Ali in the back. She's helping us with our right nutrition. And as vegetarians, we've learned that there is more muscle loss being vegetarian/vegan. And they are on top of us, like, what's your protein? What's your protein? What's your protein? And not with pressure, but with understanding, making just adjusting to our lifestyle. So just know that there are amazing doctors in this room. If you have questions about perimenopause, menopause, Dr. Fensky, Dr. Dina, and Dr. Ali are here. And I can say that because I've been helped in small and big ways by each of them.
Barbara.
Dr. Fensky, I would like to know, what do you think about the arousal creams for women that are by prescription. They use blood thinners and asthma medications and Viagra and arginine in a cream to help arousal. What do you think about that?
Yeah, I mean, the scream creams that are out there. So these medications.
Wait, do tell. Wait, hold on. So, I'm sorry. For those of us that don't know about the screen cream and want to, wait. So this is just a cream that you're putting around
So
the clitoris.
it's usually a compounded cream. It's not,
Okay.
prescription available. It's compounded at a specialty pharmacy.
And you put it on prior to sex, or you're
like
doing this
20
every
minutes
day?
prior to
Okay, like a man
relations.
would use Viagra.
Yeah.
Okay,
Yeah.
got it. Okay.
I mean, they don't
Barbara's
work
smiling.
great.
I like this.
So they don't work great. They don't work as great as what they really should. It's kind of, my experience has been that a couple of women have felt they've worked well. A lot of women have felt absolutely nothing with them, which is a call that we need better things out there. There are other medications, there's actually prescription medications you can use as well too. And then also, for some women, testosterone can do the same thing, right? And even vaginal estrogen, like we talked about before, because it increases, like you mentioned, yes, the tissue becomes thin in the vagina, but also, you have decreased collagen in the vagina, you have decreased blood flow to the clitoris and the vagina, and then estrogen vaginally, locally can help bring all of that back too. So even that can be really helpful depending on where you are.
What about Viagra for women?
Yeah, I mean, the studies haven't really supported it. That's the weird thing, right? Because it's kind of a different way that libido and orgasm issues are very different for women than they are for men, right? So it's kind of a different mannerism. Theoretically speaking, if you're talking about Viagra, right, then you're increasing kind of blood flow to the clitoris and then enlarging the clitoris and making it, protrude more to be able to have an orgasm easier, but the data hasn't really supported it so far for women.
Okay, gotcha. Go ahead.
Can we talk about testosterone and
I'm sorry, just say it again.
I hear her. She wants to talk about testosterone and what symptoms you use it for.
Yeah.
Yeah. So testosterone can be a fantastic addition, right? When we talk about replacing hormones, it's important. I personally will look at DHEA, testosterone, estrogen, and progesterone.
If you're doing the Dutch test, is that the whole thing?
Blood tests too.
Then when you do a blood test, if you go to your gynecologist and you say, I want a hormone, what should you be getting when you go to get the test?
Depending on where you are, right? Let's go back for a second. So there's a hormone, follicle stimulating hormone, right? FSH. So in perimenopause and menopause, we will often refer to FSH and say that if your FSH is elevated, it's a hormone that's secreted by the brain that signals to the ovaries to produce, right? So as your ovaries aren't producing as much, this number obviously is going to go up. But this is variable. This can increase in any stage of perimenopause, or it can be very, very late. I have tons of women who are skipping periods for 6 months at a time, and their FSH is still a normal value. So it's a tool that can be used, and your doctors probably will test it, and that's something you may want to advocate for, saying, I'd like my FSH tested. But it's important that you understand that it could still be a normal value, and it does not mean that you're not in perimenopause. Estradiol, which is the dominant estrogen that's used, is also going to be one of the hormones, progesterone. But progesterone, again, is really where you are in your cycle. Estrogen too, when you actually understand what the hormones do during your cycle.
Are you then using the progesterone through your whole cycle?
Depends on where you are, right? If you're in early perimenopause, kind of like what you had referred to before, sometimes you may benefit from being on cyclical progesterone. Say you're not producing enough of a progesterone response in that second part, that luteal phase of your cycle, then progesterone can help make your periods lighter, your cycle's a little bit more regulated.
But are you taking it daily?
You're taking it just basically from like ovulation time, depending on your menstrual cycle length, right? Ovulation time to say, so for example, a 28-day cycle, you may take it days, 12 to 26 or 14 to 26, and then you stop it, and then 2 days later you would get a bleed. But otherwise, in menopause, your progesterone you're taking usually daily. There are some people who do cyclical progesterone, which I don't understand at all. If you want to do progesterone cyclically because you want to get a little bleed because you want to see a period, That eventually will stop at later stages of menopause. In the early stages of menopause, you may get I think the one good thing is that you're not getting bleed anymore, right? You don't want to do that. Also, progesterone really can help for 90% of us with sleep, with initiation of falling asleep. So why wouldn't you want that every single day?
And how about testosterone?
Testosterone. So testosterone, answer to your question. It's true. We have really limited studies on the benefits of testosterone in women. We have some studies showing that it does help with sexual dysfunction in women. Testosterone is an important hormone for vigor, vitality, for cognition, for mood, for libido, for orgasms, as well as for ability to maintain and put on muscle, right? So testosterone levels actually start to decline in our 30s. And it's a more gradual decline. It's not as abrupt as the estrogen like we were talking about, but it's a more gradual decline. But you may benefit, right? So if you're on, say, hormone replacement therapy, which is the traditional, say, estrogen and progesterone, and still, libido's not there, and still you're at the gym, you're working out, but you just can't put on any muscle anymore, then testosterone might be a thing you want to advocate for. But in what you were saying, there's no FDA-approved testosterone preparation for women. So either you're getting a compounded testosterone, or people are doing pellet testosterone, or you're getting the prescription for androgel, which is male testosterone, and it's $110, but it lasts 10 months because you're doing 1/10 the dosage. You have to figure out what 1/10 is.
Why do we have to figure that out? It's ridiculous. It's so insane. Sorry, one more question. Okay.
Yeah, I'm curious. I'm 62. I've probably been postmenopausal for 7 years. And I tried chaga, I took all the mushrooms, I took everything, nothing happened with them. Going to bed, freezing cold, hot, whatever. I did everything. I finally got on a little bit low doses of estrogen.
Yeah.
But now they're threatening to take me off after 7 years. It works for me.
Yeah.
It's incredible.
Mm-hmm.
What do you do? Like, how do you get taken off of something that's really
doctor.
working for you because of your age? I don't have any breast cancer in my family, but they're saying, oh, you're on it for too long.
Right. Because again, that goes back to what I was saying, that still a lot of doctors are saying you're on the smallest dose for the shortest period of time or a 5-year cutoff. Your doctor's probably like, oh my gosh, 2 years past that 5-year line, she should be off of it by now. It's true, you advocate for yourself. If that doctor's not willing to continue writing the prescriptions, you find a different doctor. But we've had recent studies this past May, April. There was a study that actually just came out this past spring that showed the benefits of hormone replacement therapy continuation past the age of 65. So you
How
could
further fast? Because my uncle just turned 100. I'm planning on living a long time.
Yeah. I mean, you can. It's a personalized thing. You can be on hormone replacement therapy until the day that you die.
Okay. Good to know. Thank
At
you.
100. And one.
Robbie? Okay, one more question and then we're done.
I'm curious because, I'm in that age group and I'm in menopause and I've been talking to a lot of my friends while in it. And I sit in rooms like this and everyone's in it. Is there any optimism that there'll be more training for the medical community?
Yeah, I mean, in my world, I actually feel the opposite. I feel like so many doctors are like jumping on this kind of lightning bandwagon. There's definitely more. I mean, an example is actually the Menopause Society, right? Had their conference September of this past. Yeah, sold out. Like 2 months ahead of the conference, it was sold out. So there's definitely more of an interest.
I want to thank you for coming all the way from Texas. All the way to the other side. All right. And thank you, ladies, for coming as well. And see you on February 11th. And we'll all move to Europe.